right, class, we're back, and we're going to be talking about today a drug that a lot of us has probably even used, and it's an integral part to an allergic reaction med, but it actually has a lot more uses to it. And of course, I'm talking about the old Benadryl, and more commonly known as Diphenhydramine. Okay, but it's not just for allergic reactions, and it's so very important to stress that it's not for that. Yeah, when the Diphenhydramine hits you, yep, there you go, old Charles looking good. So again, it's also known as Benadryl. That's the more common name that we'll say with it. I can tell you right now that you will not see the word Benadryl probably in your truck because Diphenhydramine is so much cheaper. So it blocks H1, H2 histamine receptors, and it causes drying and sedative side effects, which is actually one of the things that we're going to talk about, why some other reasons that we use it. And again, it's a H1 antihistamine, it's anticholinergic and antiemetic. And we're going to get really deep into that antihistamine one here in just a second. So it blocks the effects of H1 histamine receptors. It does block A2, which is the peripheral dilation and secretion of gastric acids. So it will block those effects as well. But the big one is the H1, which is your visceral contractions and your bronchoconstriction. And the bronchoconstriction is usually the one that's kind of the big one. And it stops mast cells from releasing histamine, which is what usually causes your hives, your itching. Okay? And it does not actually reverse it. It just kind of prevents it from making more, and then it slowly wears off, and that's when you'll have a decrease of the symptoms. Again, it's an antiemetic. It does decrease motion sickness. For those of you that like to go boating, you can take a Benadryl ahead of time. I'd probably try something else before I did that one. The central nervous system, it does depress it, so probably no driving the boat. And it decreases dystonic reactions from extrapyramidal syndrome, okay? And it's from phenothiazides is when this is the antidote for that. So if they overdosed on Haldol, if they've overdosed on a compazine derivative, that's the phenothiazine derivative, that's the one where you would use Benadryl to release the dystonic reaction. They're acting all crazy, their neck's turned, they have muscle rigidity. Benadryl clears it right up. Now, the effects are immediate with the maximal effect in about 1 to 3 hours, okay? So yes, it starts working as soon as you give it, especially if you give it IV form. If you give it by mouth, it's usually 15 to 20 minutes to absorb into the gastrointestinal tract. Duration is around 6 to 12 hours, kind of depends on the person, how big they are, how much they took. Again, yep, you know when the Benadryl is kicked in because, yeah, you get that sleepy sensation. And it will, it's going to make you sleepy. Matter of fact, we had guys that would take it before going to work, and I'm like, absolutely, yeah, that's a bad idea. But yeah, we do have people that do that. So there are other choices, by the way, that's a non-drowsy. It's not Benadryl, though. That's more like your Claritin is probably a better choice if you've got really bad allergies to use that. It doesn't cause as bad of drowsy side effects. So when do we use Benadryl? When do we use Diphenhydramine? It's allergic reactions in conjunction with epinephrine. And I can't stress that one enough. So the epinephrine is going to stop the bronchial constriction. It's going to stop the vasodilation. But the actual Benadryl is what's going to stop the mast cells from, it's going to stop them from putting more histamine into the system. So one without the other is kind of a bad idea, okay? Well, you can do the Diphenhydramine for a mild allergic reaction where you don't have bronchoconstriction. That's okay. But they're going to if you just give them epi, they're still going to have, if they're still releasing the histamine from the mast cells, you're still going to have an allergic reaction, all right? So your dystonic reactions, like we talked to, Haldol, compazine derivatives, if you had a patient on psych meds, start and I can't move my neck, or they got muscle rigidity, start thinking that they've overdosed on that, and again, Benadryl is your choice. It does actually do very well to help sedate violent patients. It relaxes them out, and it's a pretty safe one. It doesn't really call the respiratory depression is not near as bad. And then the phenothiazine reactions, that kind of goes back up here with the dystonic reactions. It does help prevent motion sickness. Why do we like it in cold so much? Because it also dries up our nose. So if you got rhinitis, it's great. People do use it for nighttime sedation. Tylenol PM is Tylenol and Benadryl. All right, and it also helps with Parkinson's syndrome, so they can take that and it reduces the symptoms of that. So again, you can't have allergies if you're passed out in bed. That is so very true. And I can tell you, I know when I take it, I better be close to a bed and get ready to sleep because, yeah, you're going to be sleeping for a little while. Now, again, it's a CNS depressant, so you're going to get those blurred vision, headaches, dizziness. You can actually get a fever from it, believe it or not. You can actually have seizures, visual disturbances from it. The paradoxical CNS excitement, that also kind of extends into adults as well. So be careful with your kids because it can. My wife actually, when she takes it, she'll have this excitement syndrome. It basically works in reverse with her. It makes her sleepy, but then her brain won't turn off. Again, it can cause G wave changes. It can cause hypotension. Those are kind of rare. Any of the cardiovascular is really kind of rare. The respiratory, again, it can thicken secretions. Remember, that's what it's kind of designed to do. It can cause tightness in the chest, and it can cause wheezing. All right. So your GI tract, of course, it usually dries up everything, but again, with any other medicine, it can dry you up, cause diarrhea, constipation, urinary retention, can cause all those. And again, yes, you can be allergic to Benadryl. It is extremely rare, but yes, especially you get that with people that have overexposed themselves to Benadryl. They start having allergic reactions to it over time. Kind of like us when we wear latex gloves, we start to develop an allergy of it. So again, you take Benadryl for allergies, and then he dies from allergic reaction to Benadryl. Yeah, I hate when that happens. One common question I get, though, is what do you give somebody who's having an allergic reaction to Benadryl? Zofran actually works pretty good. Your Phenergan actually works halfway decent on those folks. So if you got a patient on an MAOI, stay away from your Benadryl. If they got glaucoma or narrow angle glaucoma, it can affect the vision and cause more problems there. If they're asthmatic or they're a nursing mom, it does cross the barriers, and it will go through breast milk into the babies. And we usually don't give it to infants. Usually 1 year of age or less. Again, usually just the straight epinephrine usually works pretty good. One of the problems that you have, by the way, is it does actually enhance cocaine effects. We had a paramedic years ago that would steal the Benadryl to help accentuate the cocaine habit that she had. And so, again, very terrible thing to happen. Atropine potentiates the anticholinergic effect, so you'll get an exaggerated response there. If they CNS, if they're on alcohol, narcotic sedatives, guys, it will enhance those effects. And the MAOI inhibitors, they prolong the anticholinergic effect of diphenhydramine, so you're going to end up with a slow heart rate for a pretty long time there. I said that backwards. They're going to be a little bit faster than what you're expecting. So your Benadryl, it may precipitate an attack in chronic COPD and pulmonary diseases. So be careful when you're using that on your patients with COPD, because again, that can make it go longer. All right. Now, usually we get it in 100 milligram in a 10 milliliter vial. Actually, the ones that I've always seen is 50 milligrams in 1 ml. That's what we usually use. And again, we usually give 25 to 50 milligrams slow IV push that prevents them from blowing out their blood pressure. Okay, and then 50 milligrams IM deep if you can't get an IV established. The key thing is to get this on board as quick as possible. If you know you look down and you can't see an IV, go ahead and give the 50 IM. It's perfectly acceptable to do. Actually, the extrapyramidal syndrome, I actually kind of prefer to give it IM. Again, it's 25 milligrams IV or IM. And the reason is that way they don't just snap out of it. It's a slow release and then a slow release from the extrapyramidal syndrome. No more than 400 milligrams a day. That is a lot of Benadryl. Pediatric dose is usually 1 milligram per kilogram, up to 25 milligrams for a smaller child, up to 50 milligrams for the bigger ones. Usually the really tiny ones, we're not going to give them Benadryl anyway. So you can repeat every 4 to 6 hours, and your maximum single dose should not go over 50 milligrams. And again, in a kid, no more than 300 per day. Yeah, you don't want to see little junior like that. So again, we can give it IV, we can give it IO. We want to give it deep IM, not subcutaneous. So we got to give it deep IM, big muscles. Okay, probably not in the deltoid. Deltoid's kind of a bad idea here. And yeah, I'm getting ready to hear, oh, I'm giving it a deltoid all the time. Okay, you should probably put it in a little bit bigger muscle. And then they also have tablets. Remember that. Don't. And by the way, the tablets, again, just a little bit slower to absorb. And then your pregnancy class is a no adverse effect on the fetus in laboratory testing. But again, just remember it can cross the milk barrier, so it can go into the baby via the breast milk. All right, yeah, this is my favorite one, actually. I love giving this one to the old cranky, upset patient. Yeah, somebody needs a cocktail. 2 milligrams of Ativan, 5 of Haldol, and 50 of Benadryl. Prevents the dystonic reaction and just calms them right down. If your protocols allow for that, I would say absolutely go for that. But you'll be surprised that Haldol and Benadryl or Versed and Benadryl do a really good job of chilling somebody out, okay? So keep that in mind. Matter of fact, a lot of people forget, and Benadryl's a pretty safe drug to give. All right, that's going to be it for Benadryl, and I'll see you guys on the next one.